Hi, this video is the art of hair transplant restoration surgery and on a black African American woman who has hair loss all the way around here and underneath and toward the back. And she did many years of research, and it's really bothered her because it's hard for her to style her hair. And our goal is to restore the hair. This type of hair loss, steroid injection is not going to help much. And Rogaine can potentially bring some hair back, but mostly peach fuzz. And you had to take medicine for the rest of your life. So hair transplant is one of the better treatment. It's not a cure. The transplant hair should potentially last very long. But we cannot do anything by your existing hair. If the existing hair will continue to thin out, then you're probably going to need more than one surgery. The surgery will last for 12 hours, and it will take a whole year for it to fully grow. Again, hair transplant is not a perfect science. If you watch and research, sometimes you might need more than one surgery. But you had to find some surgeon who specializes in the art of restoring black woman hair, or for men as well, black men, because otherwise it won't grow that well. This one client, I talked to her yesterday. She talked to me last year, and then she decided to go with a clinic nearby her place, just for the fact that it's just closer by. But that clinic did not show them much of the before and after. The ultimate thing is not what the surgeon or the clinic tell you that he specializes in black curly hair. It's how many before and after that he can show you, or the surgeon or the clinic can show you, and that can tell you that this clinic does a lot of black hair, curly hair. And so to make the story short, I ended up had to her hair grows that she had it done nearby, and hardly anything grew at all, and it actually didn't make any much different, and actually it looks worse. So now she had to come over to California for me to fix it. But for this client, I thank her for allowing me to show that this hair loss is advanced, and we had to shave all this baby hair when I put the hair in. There's no way around it. Where the hair I harvest in the back on the top toward the high end, we don't have to shave those hair. We only cut out what we shave. So we shave a small area and we cut it out. And again, surgery will last 12 hours. And there's a whole artistry behind creating natural hair, because you don't just put it anywhere. The woman hairline is very complicated, and it has a lot of meticulous detail. And if you follow all those details, you will have a very fantastic result. The other downside of hair transplant, again, is sometimes only 10% of the women have what they call scarring at the base. Where I make the hole, there's scarring at the base, and it's just tiny lumps coming out from the hair. It only happens with black ethnic, but with Asian and white and Hispanic, when we make the site, and then it doesn't really cause tiny lumps at the base. It's different from cobblestone. Cobblestone is we transplant at big roots with a lot of skin on it, and that's happened even for Asian and white. If you transplant very large root with a lot of skin, so instead of raised up, it's actually divot and have a dimple and all stuff. But for a tiny speckle of scarring can be at the base of the hair follicle. It's tiny, so you have the alternative for that, risk of that, versus being bald. So it's kind of hard, but it's a decision that women have to understand. And I try my best to trim all the graft as much as we could, and trying to minimize that tiny scarring. But again, sometimes it's due to genetic as well. So this is the art of hair transplant on a black woman with a very advanced hair loss pattern. And hopefully she lived nearby and she allowed me to show the follow-up. And I'm excited for her, because I know that there's a good possibility she'll have very good result. And now she's going to need more than one surgery, unfortunately, because her hair loss is very advanced on both sides. I will try my best. And it's going to be at least a 12 to 16 hour surgery. Thank you.